Welcome to a new episode, Smile is in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today with me I have Dr. Garr. Dr. Garr
Yes.
just jumped off a plane 10 hours ago. You were in the United States,
Yeah.
right?
Yeah.
So, and I welcome you here at TMS and NEO.
Very nice to be here. Thank you.
So I read a little bit about you, and I noticed that your granddad was a dental technician, right?
Yeah, exactly. Yep. That's how he kind of inspired me to be, go in the dental field.
Yeah, 50 years as a dental clinician.
Yeah. Yeah.
So, I read something that you said that it was his fine details that brought you to the profession that you are using today, that is to become a dentist. And what kind of inspiration you got from him?
I grew up watching him. He had retired by the time that I was around, but he would polish stones and make all sorts of things down in his basement lab.
Yeah.
And so I knew he worked well with his hands. He was very detailed, very much into the details of everything. And so I, my coaches, my soccer coach was a dentist, my neighbor was a dentist, and then my grandfather was this technician, and I was just kind of surrounded by dentistry and inspired in that way.
Oh, that's always good. And it's interesting because your granddad was working as a dental clinician, so he was already trying to repair the problem that were existing in the mouth.
Right.
And today you are trying to prevent it through the guided biofilm therapy, right?
Yeah. Yeah. Exactly.
How come? How from
It
treating to prevent?
I went into dentistry not even knowing what dentistry was going to be for me. I knew what it was then, but I didn't see the future of it, what it is now, right? So years later, we're so much more into prevention and trying to prevent everything that was damaging everything from before. And even now, it's just can you keep up with it? But the prevention of dental disease, caries, inflammation in the mouth, all the whole body systemic connection is so big today, and inflammation is a big word. So many more things are happening in dentistry today than we even knew when I started dental school, right?
Like you said, it's difficult to keep up with the most recent technologies. And before, off the record, you told me it was a great addition to your practice. You were talking about the airflow prophylaxis master.
Yeah.
How did you came across to the airflow prophylaxis master and its concept that is the protocol, the guided biofilm therapy?
I kind of stumbled over into the Prophy Master, but I didn't know that existed. I think all I knew was the handy, the small handy one that we had, and that our dental rep had sold to us, and it was functional and worked for its purpose, but I was just kind of left with there's got to be something better. And then when I looked into trying to repair that or something happened, I found that there was other things that EMS had that were much better. And so finally we got on board with GBT, and then the rest was history. It's totally changed everything.
And what was the biggest difference between the handy and what you practice today with the GBT?
Yeah. So, just the whole protocol is different. We're following the whole GBT protocol for one. Before we just kind of used it as an adjunctive tool, with what we were doing in our regular hygiene visits. But once we got the Prophy Master and got involved and got all the training and got involved with everything the way that the GBT system is really meant to be, that revolutionized everything. So
we need to be honest. It's kind of recent that we are really approaching the North American market, and do you feel this movement also in the States, that people are looking more in terms of alternative technologies, but also to have a more holistic approach?
Yeah, in hygiene too. My hygienists have told me, you go to all these classes, you bring home all these cool things, new tools, new everything, implants and veneers and all these neat things. But for us, it's just the same old thing all the time until now. And this has been the first big revolutionary change for our office. And I think that's what other offices are picking up on too in the United States,
Yeah.
is that this is something different. It allows your hygienist to be much more effective in what they do every day. It's more fun, it's exciting, patients love it. It doesn't hurt like, they're anticipating the scraping and everything. And then you're finished and they're like, "Wait, there's no scraping today?" So patients like it a lot more. So I think hygienists and dentists and offices are all like more excited about it because it's so different than what it's always been.
So you are getting also the feedback from the patients.
Oh yeah, yeah. We had a school administrator. He was telling me days leading up to his visit, like, "Oh, I got to come see you." I'm like, "Well, okay," and he's gonna go see the hygienist. And I saw him a day later, and he's like, "Oh my gosh, you didn't tell me that you had this new cool stuff and the GBT model and everything." And so he's like, "I was built up all that anxiety for nothing, and now like I'm excited to go back to the dentist and get my teeth cleaned."
I think that's what motivates us, right? When we have the feedback from a patient that never like it to have his teeth scrubbed, like you said before, and all of a sudden they are enthusiastic more than us actually. With something that now we find quite trivial and quite normal, but for them can change really their approach.
Yeah, I mean, it's still can be repetitive, right? For the clinician to kind of do the same thing, say the same words to this, different patient every time. But as we remember that those patients, for them, it's new. It's something different for them, and it's personal for them. So we try and keep that personal touch with each individual.
How many hygienists do you have in your practice?
We have 3.
3. And did you got the same feedback from all of them?
Yeah. So we did the training all the same time, and then every day, like, they're coming back saying, "Oh, so and so, really doesn't like their visits, but today they're like, oh my gosh, that was so much better." So
So the 3, and you said that they had the training, so they had the Swiss Dental Academy course.
Yeah. So we did that on like Zoom or whatever, and so once we did all the training, and then we started getting like patient feedback after that, building up to like 50 or whatever, and then became like GBT certified. And I think it really gave our hygienists like some kind of motivation or some like empowerment, like they're doing something more than just cleaning teeth all day, right?
Well, we noticed that dentistry is shifting for this holistic approach and to have a more preventive role. But do you feel that from the patients you have also the same approach or the same requests, that they want to keep their teeth, their natural teeth, they want to do as less as possible in terms of dental work, or do you still find that people are not in this role of caring and preventing?
I think there's a range for sure, and we're in a town where there's all ranges of people, and so there's more and more, I think, are leading more to the prevention mindset, whole body mindset of health. People coming in with diabetes or heart disease, or maybe not themselves, but their family has that risk factor already. So we're talking about inflammation, we're talking about the biofilm, we're talking about all the bacteria that, our mouth can be that window to the body, right? So if the mouth is healthy, the rest of the body is, can be much more healthier. So we're having those conversations, and we were having them before, but I think the key difference with the guided biofilm therapy is engaging the patient. This is what we've seen is there's better engagement with the patients after you disclose and educate and motivate. So when I come in to do the exam with the patients, I'll just kind of say, "Hey, how did you like what you're receiving?" And all the pink and purple stuff, and they're like, "Oh, I thought I was doing really good brushing." And these are patients that typically brush well, but now that we disclose and go through all that, they're coming away with more kind of knowledge of how to do it differently and how to do it better at home and be more effective.
It's true that we have the meet and greet, but the disclosure is a real icebreaker, maybe in the discussion when we are talking oral health, and the patients notice that it's not just something that we are mating up that is there in the mouth of in their mouth, but it's something that is real and it's there,
Yeah.
and then we can disclose it and they can see it too. And they start getting noticed that, oh, this is not just a cleaning appointment. It's not just to have a pretty smile, but it's something that I need to do to avoid disease, or I need to do to be healthy.
Well, and we've been trying things all along to try and motivate. That's what we are. Is we're motivators. We're patient motivators, right? Because if they don't do what they need to do at home to make their own health, like we can't do that for them, right? So we've been trying all along to try and use different things to motivate and educate and get them to do what it takes to be healthy. And we have a microscope in the office, so we can put a slide and put up on a big screen. You don't have to look through the little ice things. Just a big screen next to it of all the bugs swimming around in their mouth, and you think this will be motivating, and it can be, but this is much different. Now they go home knowing just where and how and why, more than just what's seen on a microscope, because I think this makes it more personal, because you can see your own teeth.
Yeah, you can see, and if you can see, others can maybe see it too. So it's also kind of a shame. It's not nice to say this, but it's true that sometimes they feel ashamed. Like, I have all of this in my mouth. Oh, how can you help me? I got this kind of patients when they are asking, oh, can you see it? Can others see it? How can I remove this at home too?
Right.
So I think one of the things, and you said quite well, we are patient motivators. I call it mostly educators. We are educators because we are educating the patient to improve themselves, but also to improve at home. And interesting enough, when we use the disclosure, I got some patients that asked me, can I do it the same at home? Did you got this kind of feedback too?
There's a couple that will ask that, we've had disclosing things for years, right?
Yeah.
But if you don't have the right tool to remove it in the office, and that's what's been so nice about the GBT. But at home, it's good. It's a good test for them, right?
Yeah.
To get after it with their toothbrush and interdental flossing and picks and everything else that's out there.
Such a good point, because this reminds my college years when you are having the patients, you learn how to disclose in university. But then you always had a hard time to remove all the disclosure with the polyspace and the rubber cup. So at the end, when you finish your course, your degree, you really don't want to do it, because you know that you're gonna always leave a little bit of disclosure behind, and the patient will see it.
I think that's the reason we don't do it in dentistry, is because we don't have the tool to remove it.
Yeah.
And then it makes us look bad.
Yeah.
So I was telling a friend about GBT the other day, and he came up to visit from another state, and I said, you need to get it. And he said, well, I do. And he's working on all these other projects too in the office. So it's all everything gets expensive when you have all 10 different projects. And he said, well, what if I just disclose now, and just do that part? You can, but if you can't get it off, you're going to look kind of silly with tools that don't work.
Yeah, we are always afraid. And I talk by experience. I got to college, and for 6 months I just wanted to do the most impressive work and have a wow in the face of the patients. But truth is, when we learn about GBT and we start disclosing it, we think on the past. I think on my past, and I say, I've done a really lousy job before, so how can I improve myself today and say sorry? And I profit from this platform to say sorry to my old patients.
Always continual learning.
Always continuous learning, and that's it. We try to do our best.
Yeah.
So, Dr. Garr, it was a pleasure to have you on the podcast. So
Thank you.
Always good to have an American accent also on the podcast, and not just my mixed accents. So thank you so much. And for all the listeners, thank you for listening to another episode of Smiles in the Air. And subscribe in any platform, Spotify, Apple Podcasts, or even on YouTube. And don't miss the next episode. Thank you.
Thanks.
Thank you.